Welcome to the Story of Medicine, the channel where we explore how humans have learned to heal across the centuries. I'm Rebecca, and today we journey into the invention of anesthesia. I'd like to ask you to imagine something. Try to step with me into a surgical room of the mid-19th century. Dim light, a sharp smell in the air, a patient held down by strong men, and a surgeon who must work fast, very fast. At that time, there was no modern anesthesia. Surgery was an act of desperation. Pain was unavoidable. Screams were unavoidable. Speed was the only weapon surgeons had to limit suffering and to give their patients a chance. Many surgeons were judged not by their precision, but by how quickly they could amputate a limb. Some could do it in less than a minute. That was the only hope the patient had. And yet, the dream of taking pain away was ancient. For centuries, people had tried everything: opium, alcohol, mandrake, herbal mixtures. None of these could make someone safely lose consciousness. In the early 19th century, chemists and physicians began studying two curious gases, nitrous oxide and ether. At that time, they were used at fairs and public demonstrations. They caused euphoria, dizziness, and a strange feeling of insensitivity. And in that context, a man appears who is destined to change everything: William Morton. Morton is not a famous professor. He is not a great surgeon. He is a dentist, ambitious, determined, and fascinated by chemistry. He studies. He experiments. He observes the effects of ether on his own dental patients. He notices something extraordinary. Ether can induce a deep and reversible loss of consciousness without apparent harm. Morton has a simple, revolutionary idea. This substance might allow surgery without pain. He prepares himself. He designs a primitive but effective device to let patients inhale ether. And he convinces the surgeons at Massachusetts General Hospital to give him a chance. And so we arrive at the day that will change medical history forever. Boston, October 16th, 1846. The scene takes place in the famous Ether Dome. The gallery is crowded with physicians, students, skeptical professors. Most believe the experiment will fail. Some think Morton is reckless. Others think he is a visionary. Morton walks in, holding a glass inhaler filled with ether. Next to him stands the patient, a man with a tumor on his neck. He is frightened. Understandably. Morton places the mask on his face. The man breathes. Again. Slowly, his muscles relax. His eyes close. His body becomes still. Total silence. Everyone watches. The renowned surgeon John Collins Warren steps forward. He checks the pulse, touches the skin with the tip of the scalpel. No reaction. He begins the operation. He opens the neck. He works carefully, calmly. That calm was something surgeons of that era could never afford. The patient does not scream. He does not move. He does not suffer. The entire hall is frozen in disbelief. When Warren finishes, he turns to the audience and says the words that will become famous. "Gentlemen, this is no humbug." In other words, this is not a trick. In that moment, medicine enters a new era. News spreads quickly across the United States, then to Europe. Attempts to reproduce the experiment begin in London, Paris, Vienna. But resistance appears as well. Some argue that pain is a moral component of surgery. Others fear the method. Others criticize Morton for trying to patent the use of ether. That decision will follow him for the rest of his life. But the revolution has already begun. There is no going back. Within a few years, surgery changes completely. It is no longer a race against time. It is no longer a brutal act. It becomes a discipline of precision, silence, and science. Without anesthesia, we would not have modern abdominal surgery. We would not have thoracic surgery. We would not have neurosurgery. We would not have microsurgery, nerve reconstruction, organ transplantation. Everything begins there. On that day, in that room, in Boston. And Morton? His life ends sadly. Between legal battles, rivalry, and financial hardship, he dies poor. But his name remains written in the history of medicine. October 16, 1846, is the day the world changed. The day surgery stopped being a test of endurance and became a science. The day modern medicine was born. Our journey continues. And this is only the first story. Thank you for watching the story of medicine. If you enjoyed this episode, please give it a thumbs up and subscribe. Join me again for the next chapter in the history of healing.